Hello, everybody. Welcome to Fertility Factor Fiction. I am your host, Dr. Rahi Victory, a reproductive endocrinology and fertility specialist, double board certified in Canada and the US. We are here to talk to you about all things fertility, answer your questions, and if you have any gynae or obstetrical questions, happy to answer those too. No paper to review for tonight because there was really nothing interesting to review with anybody. I looked at all the literature in the last week, and to be honest, it was all pretty boring stuff that no one is interested in. So, nothing earth shattering. One interesting study, meta analysis, I think published in Human Reproduction, which demonstrated that there is a 20% chance, meaning 1 in 5, that if you do an IVF cycle, you will subsequently get pregnant on your own. So that was kind of huge, really important. Good information for everybody to have on hand because that's a big deal. And so I think that that was quite interesting because a lot of people, wonder, like, after I do IVF, will it be easier for me to have my next child? And the answer is, it looks like it actually will be. Whether it's the body learning the protocols and the pathways that are necessary to go from being infertile to being pregnant, or whether it's got some sort of beneficial impact just being pregnant, we're not sure, but they definitely demonstrated there was an improvement. Another interesting meta-analysis that has come out very recently, also demonstrating that the supplements for guys does actually improve, and for women, does actually improve live birth outcomes. So kind of interesting because I am a believer in the supplements. A lot of people are not. But I think they make a difference. So it looks like there are ways that you can improve your live birth outcomes, which are not pounding you full of synthetic meds. Just using natural supplementation, vitamins, and so on can be beneficial. So I hope you guys all had a good week. Huge congrats to my wife, who survived 29 years of marriage with me as of yesterday. So, honey, I love you. And thank you for making it an amazing 29 years. And for our wonderful, beautiful 3 kids, and the life that we've created, and all the people that we've helped. So I love you, and thank you very much for all that you've done for us. Wendy, for those of you that don't know, is the business manager here at VRC, and has done an amazing job for years and years and years. So huge thanks to Wendy for all of that. Yeah, we had a great night last night. If you guys live local, the Capitol Grill is open again at Somerset Mall in Detroit, so we made it over there. I guess they had a fire a couple of years ago and shut down. Food is just as good as it always was, and it was an amazing evening. So super fun and great food. Make it out there if you get a chance, for sure. And I have my trusty sidekick, Tarek Ibrahim, here from Ibrahim Strategies Group, and he is going to be managing the questions. So feel free to ask your questions. I think we still had some left over from last time as well. So if we don't have questions from today, we can always take those. But I'm assuming there's a load of questions like there always is. So yeah, fire away. I'm ready.
Comment to your anniversary. That's a life sentence she serves.
Was that from one of my kids or something?
No. Well, someone that's, a lot of comments.
Yes, well, my wife has served a life sentence. That's true. Yeah, I think we both have. So yeah, she's a pretty amazing lady, and God bless her. She's survived 29 years of a very hectic life. So pretty cool.
Happy anniversary, doctor.
Oh.
Is the embryo grade important for an FET?
Yeah, so the embryo grade is important. There are multiple studies which show that A and B grade embryos definitely have better implantation and live birth potential than C grade embryos. There are a couple of big studies on this. They did vary in whether the trophectoderm, which becomes the placenta, which is the second letter, or the inner cell mass, which is the part that becomes the baby and is the first letter, are more important. In the one study, they actually said it was the inner cell mass. In a number of other studies, they've actually shown that it's the placental grade which is more predictive. So that was kind of interesting to see, but definitely there is no question that the grade of the embryo, including the size of the expansion, the grade of the inner cell mass, and the grade of the trophectoderm, do have a significant impact if they are in the poorer grades. Between A and B, there's not much of a difference at all. But between A and C and B and C, and certainly the D grade embryos, there is quite a significant difference. So your embryo grade does make a big difference for your embryo transfer, and the degree of expansion makes a difference as well. We know that going into a freeze, a 3, 4, and 5 are the best, and coming out of 4, 5, and 6 are the best. So we've got videos on that from our show, so just check it on our YouTube channel and you'll find them there.
Hey, Dr. V&T, can you please review the current immunologic testing that can be done and when it's indicated? Cheers.
Indicated.
Indicated.
Yeah, I mean, it depends. We normally do it for patients that either have an immunological problem to begin with, they have an arthritis, Crohn's disease, an autoimmune inflammatory condition, something like that, like a Sjogren's or any kind of rheumatoid, that kind of thing. Lupus as well. So, and then we also do it for patients that have had recurrent implantation failures or recurrent pregnancy losses. What kind of testing can be done? That varies between physician to physician. So some people go all out and do the Alan Beers lab testing, which tests you for everything under the sun. And they're literally like 30 or 40 different things they're looking at. I find that excessive because we know if you look for enough things, you're going to find something. Everybody will have something. So I tend to focus more just on the key elements. So we look at natural killer cells, your cytokine ratio, T helper 1 to T helper 2. We look at DQ alpha. In some cases, we're looking at the KIR. We look at anti-paternal antibodies. So those are the ones we focus on. And we just do it through one company because they're cheaper, but you can use any company you want. It doesn't matter. So those are the tests we're looking at. And then we also look at the vaginal and the uterine microbiome because I think that's an important part of the picture as well.
Just ask the TikTokers if they can hear you or not.
Can you hear us on TikTok?
Did you do something with your phone when you answered it by any chance?
No, why is it stopping TikTok?
No, but...
No, I just hit end the call.
No idea. Okay.
Why are people saying they can't hear it on TikTok?
Doesn't, yeah, which would be so weird.
So is anyone answering yes? Can you guys hear us on TikTok?
Yes, we hear you.
Oh,
the human
fine.
being said he can hear us. That's his name.
All right, cool. Well, thank you for answering. Okay.
Your best friend from Holland is here to support you.
Oh, hi, Soraya. Shabbat Shalom Becher. I'm assuming she's Persian.
Hi, Dr. V&T. What do you suggest for morning sickness? Any pills?
Oh, great. That's a great thought. You know what? That's a good video. Yeah, that's a good video. Okay, so treatment for morning sickness. Number one, diclectin. So it's available in Canada and now it's available in the US. I think in the US it's called Diclegis. Don't quote me on that, but I'm pretty sure it's Diclegis. So it's a combination of vitamins and supplements. It has no negative side effects. It's been used for, I think, over 60 years now in Canada with no evidence of any harm of any sort. We start our patients off 2 pills 3 times a day. The one big issue with it is a preventative. So you've got to use it all the time to prevent the nausea. You don't take it when you feel nauseous, hoping that it will quell the nausea. It does not do that. You got to take it all the time in order to prevent the nausea. So that's number one. You can use Gravol or Dramamine. You can use Maxiran. And then for the people that are really suffering, we use Zofran around Danzatron, and that can be used as well. Any of those are reasonable. If you're still feeling queasy beyond all of that, unable to hold things down, antacids can be helpful in certain cases. Or acid reducers, even like Panaloc. In some cases, we check patients for making sure they don't have the stomach ulcer bacteria, H. pylori, Helicobacter pylori. That can be important as well. And in certain refractory cases, they need admission and assessment by a gastroenterologist. But generally speaking, in the vast majority of cases, we can get it controlled with the meds, usually at home or at least on home care. it's pretty rare these days that we have to admit people to a hospital for this.
Any suggestions for pigmentation during pregnancy?
Well, your skin color goes darker. It's called melasma. You get a little more yellow and dark in pregnancy because of an increase in melanin stimulating hormone. So that's natural. There is nothing you can or should do about it. Just leave it alone. Yeah. Some women don't like that line that they get up and down their belly. It's called the linea nigra because it goes dark. It's probably going to fade after the pregnancy, so don't panic. And it's quite normal, so it's nothing to worry about.
How are 6BC and 3BB embryos?
Well, a 6BC is fully expanded, so in that regard, it's good. And the B grade is representing the inner cell mass, which is the part that's going to become the baby. And a B grade is again good. A C grade isn't quite as good, but a 6BC is probably a pretty potent embryo. So hopefully, as long as it's genetically normal, you have a reasonable chance. A 3BB is a great embryo. We're happy when we have 3BB, so I got no trouble with that at all.
Is yellowish discharge normal 3 weeks after a D&C, no fever, pain, odor, or anything?
Probably, but if you're worried, make sure you go see your doctor. Those are the kinds of things I can't answer because I would need to see you. So if there's any concern, always go see your physician. We wouldn't be too panicked about yellowish discharge. Some women routinely have yellowish discharge, but if there's pain, fever, itching, it's getting more, there's an odor with it, anything like that, go get checked out. And either way, you should probably be seen to make sure it's okay.
Happy anniversary to you both.
Thank you. I don't know if my wife's watching. Last week, she jumped on because we were past 9 o'clock and she told everybody to stop the show. Yeah.
Hi, Dr. Victor. Congratulations on 29 years.
Thank you. Appreciate
Getting
that.
ready for the 4th FET, and we have a laundry list of immune meds.
Oh, wow.
What is Plaquenil used for? What is Neupogen shots indicated for? Hi, Tyler.
So Plaquenil we typically use for people with NK overactivity or excess number of NK cells. It can be used for patients with lupus. It has some blood thinning capabilities as well, and it's a good anti-inflammatory. Neupogen can be used for a variety of reasons. They use it a lot for the KIRs. There is evidence that for patients that have thin lining, you can use Neupogen as well. For patients with immune-mediated recurrent implantation failure, Neupogen has been used. So there's a variety of different things that you can use it for, but those are the kind of groupings of the immune patients that we use it for. I don't use Plaquenil a lot. In fact, very rarely. I think there's stronger and better stuff out there, intralipids, steroids, that kind of thing. But there are a lot of studies on it. And in a review we did on the show probably 3 years ago, Plaquenil was one of the drugs that the review article said actually had evidence for benefit. So it is usable and reasonable to do. And I don't think it's that expensive anymore.
That's something I think you would know best.
I have no idea. That's a pharmacy
That's a
question.
pharmacy thing,
I
yeah.
stay clear of the pharmacy stuff. Yeah, I don't know anything about it.
Congrats, Dr. V and Wendy, for 29 years.
Thank you. Appreciate that. Yeah.
Hello, Dr. V. I finally had a successful transfer. Things
Awesome.
are going very well. My first beta was 260,
Okay.
second 700,
Excellent.
third over 2,000, followed by 12,300, and a week later today, we saw a heartbeat of 118 beats.
Wicked.
Yeah, I think that's it.
That's awesome. Congratulations. That's wonderful news. Don't know if you followed our protocol or not, but that's great. Super happy for you. Congratulations.
Continues down as we scroll.
Oh, okay.
The only issue was that my HCG only increased a little bit from a week ago, from 12,300 to 12,500. Does that mean I will be losing the pregnancy?
Oh, that's concerning. So make sure you get checked for sure. It should go up. Now, it doesn't go up exponentially once you're into the tens of thousands, but it should be going up more than just a few hundred. So definitely get checked out. Oh, now I feel bad that I said congratulations. I'm sorry.
They gotta write them together.
They got to write them together, yeah.
Can you explain what testosterone priming does? And
Yeah.
when during the luteal phase would you typically start testosterone priming?
So my read of the literature on testosterone priming is that it should be started before your stim, anywhere from 14 to 30 days before. The idea behind testosterone priming is that when you provide the ovary with androgens, it uses it as the building block to help the cells that surround the egg produce estrogen. So you're really just giving it food to create estrogen, which it needs to help support the egg growth and development. So that's the rationale behind it. We use it 14 days before. Some people go further. I think you can start probably causing overdose if you go too far or too early. So we use a very low dose and we use it once a day, every day for 2 weeks and through the stim.
What's the advantage of microdose Lupron protocol? Who is it good for?
Well, the first thing is that microdose Lupron protocol is no longer available, at least in Canada, and I think it's almost done in the US as well. So it's actually hard to get a hold of. The original studies on microdose Lupron were from a long time ago, where they tried it to see if they could essentially cause the flare effect of Lupron to be beneficial for ovarian stimulation. And the early studies showed that it was. We actually loved it, and I used it all the time, but it's gone now, so we don't have it anymore. But it can be a very useful approach to things. So if you have access to microdose Lupron and you have diminished ovarian reserve, that's who it's really good for.
I have a consult coming up with you.
Great.
Very excited.
I'm excited too. We've had loads of consults lately. Lots of refugees, as I like to call them, from some other fertility clinics. There are lots of people out there who struggle with their clinic and their doctor and don't know if they should trust their doctor or not. I talked to a recent US couple who said not only did they do the ERA once, but they were still being asked to do it a second time because they were changing the protocol. I was like, oh my God. So I had to actually pull up the study in the middle of the Zoom that shows that it actually decreases your success rate. So yeah, we're happy to do consults because we love helping people. So if you need help with your fertility, definitely let us know. We're happy to do what we can.
Are there tests you recommend having done prior to that visit to help us save more info, fertility or anything similar?
No, because every case is different, and I really need to know your history before I tell you what to get and what to do. Because in many cases, there's tests that you do need, and in many cases, there are tests you don't need, and we can save you a ton of money. So I don't want you wasting your money. Make sure you get checked out first.
Hello, handsome duo. How do you sign up for your donor embryo package? I contacted your team. I gave my name to Lisa. Is there anything else I need to do to be on the wait list? Thanks.
Nope, that's it. Once Lisa knows, she'll go through the list of embryos that are available as they come up, and she'll notify you when some are available. So there's nothing else you need to do. It's just contact Lisa.
Hey T, may we put a face to your wonderful voice?
The age-old question. Yeah,
It's too much ugly.
no, he's actually quite a handsome guy. Don't believe him. Yeah, we got to bring. I think I've been thinking about this. I think we should just do it side by side now.
You never know.
I think we should. You'd just be there. I'd be there.
It has to be a reveal if you're going to do it like that. It's going to be a big reveal.
You have been on camera before.
Yeah, they didn't catch it.
There is one video where you kind of run by the, and then there's that other one where you're crawling on the floor. Yeah. You know what? Thumbs up if you want to see Tarek, and we should do a side by side from now on. Maybe we'll have to move it to the couch, and we would just sit there together and go over all the questions. It would be. How would we set up the?
It'd be a setup.
We'd have to have like the computer screens, and we both be in front of them and have the cameras kind of looking down. We could do that. We could do it.
It could be done.
Yeah, it'd be cool.
One thumbs up. I don't know if that
Oh, my poor friend Tarek.
No.
Tarek, by the way, is fasting for the second Eid in Islam. And so it's the Hajj-related Eid, the pilgrimage. So the poor guy is starving to death, and I am a horrible friend drinking tea
No,
in front of him.
not at all.
But I will lose my voice, and I don't think you guys want to hear me croaking.
I can always answer questions, you know.
Yeah, Tara could always answer. Yeah.
Yeah. Okay, where are we here? Hi, Dr. Vinti. With all the advancements in technology, how frequently do twins still go undetected until later in pregnancy?
Never. I have not had an undetected twin since I was in residency. So I think I was in second year or third year of residency. So we're talking 2001,
A lot of-
2000, 2001.
A lot of thumbs up. So
Oh, they're now coming.
There's a lag.
You want to
There's a
throw
lag.
that in there. So, you know what? I can't imagine why someone would miss twins. Like it's almost unheard of. With modern ultrasound technology, unless the ultrasonographer was not, seeing everything at the time, then there's no reason why you would miss twins. But I guess it's possible if they were sitting right on top of one another or whatnot. We had one case not too long ago where they actually had Siamese twins. So they were conjoined twins, and I couldn't tell because it looked like you were just rotating the ultrasound probe, and then one would show up, and then the other one. And it just looked bizarre. It wasn't until later that we realized they were conjoined. Measure your levels. In US levels over 45, and Canadian 150.
So for the people on YouTube,
Yeah,
Facebook,
yeah.
somehow your computer just refreshed the whole window. So if someone on YouTube or Facebook didn't have their questions answered, they need to re-ask it. And we need to see those thumbs up, even though they might be a little bit. I understand.
So why did it refresh?
I have no idea. It just refreshed.
Oh, that's weird. Guys, if you ask questions on YouTube and Facebook, I apologize, but for some reason the computer glitched. So just ask your questions again. These are the fun things of doing a live show. So,
hello, Dream Team. What's the difference between, if any, 2cc and 3cc embryo? Which one is better? Thanks so much.
it depends on the grading scale. So if it's the 1 to 6, the 3 is better because it's more expanded. If it's the 1 to 3 scale, the 2 is better. And I know it's confusing and I wish they'd standardize it, but they haven't yet.
Soraya's saying you look really good.
Well, thank you, Soraya. That's very lovely of you. I'm sure my wife of 29 years is going to be happy to hear that.
Absolutely.
Yeah.
Embryologists decided it was best not to send embryos out for genetic testing.
Yeah.
Why would they say it could harm them?
Yeah, I mean, sometimes if we have to go into the embryo, it's a little more risky. You can damage the inner cell mass. That's not quite as safe as lasering it when it hatches. So embryologists can be a little bit more reluctant. I know our embryologist is a little more reluctant to dive into the cell, but it is possible. And then it also depends on the quality of the embryo. So when we get CC grade embryos, we're really reluctant to genetically test them because those are already weak embryos. We don't know what the impact of biopsying a CC is. So we're a little more hesitant in those circumstances.
Is taking a prenatal multivitamin for more than a year for FETs and between FET cycles too long? Is it good to give the body breaks for multivitamins?
No, not at all. None of us, unless you're like the healthiest diet person in the world, none of us get sufficient vitamins. Everybody is vitamin deficient. So you're much better off taking the vitamins than not taking them, for sure.
Why is fertility testing only done in Greece?
Well, fertility testing isn't only done in Greece. I'm sure you can get it done other places. So, for example, their immune panel is a fraction of what you can get in Chicago. I forget the name of the place, or the Alan Beers lab in LA and Miami. they offer way more testing. The reason we kind of focused on Fertility, or at least recommend Fertility to our patients, it's like a fraction of the cost, literally less than, I think, a third of the cost. So that's why we use Fertility, but you can go anywhere you want. Why is it only in Greece? We are in the process of looking at doing one part of their testing here, but not all of it. As far as the immune stuff and all of that, I mean, they have a big lab and they set it up there, and everything's cheaper there, right? So it's easier. You don't have to pay people as much to do the work, and therefore the tests are cheaper. If we set this up in Canada or the US, it's not going to be cheaper than going to Fertility for sure. I looked into the price of the infection, the microbiome testing, so it's pricey. It's actually quite pricey. It's significant. So they're not making a ton when they do that test. We would, if we were doing it here and we charge what Fertility is charging, we'd probably make $150 per case. It's almost not worth doing. So I mean, I want to do it because I think it's good for patients. They wouldn't have to wait as long and less shipping and all that stuff. But from a profitability standpoint, it's not worth doing. You got to find someone who's willing to do it because they care, not because they're trying to make money off of it.
Do saunas reduce testosterone?
Heat is bad for your testicles. Not sure if it reduces testosterone directly, but I would anticipate the answer is yes. But it definitely has a negative impact on sperm quality.
Hi, Dr. V. We spoke earlier in the week. Thanks for your insight on my question I sent over Instagram. Heart.
Oh, you're welcome. Congratulations.
Is it normal to ovulate later than usual after my first period post DNC?
Yeah, I mean, after DNC, things can get kind of screwy for a little bit, so that's not unusual at all.
Would you still do a transfer for your patient if they are still positive with urea plasma and BV? What about H. pylori?
So H. pylori you should definitely fix, because if your stomach is producing too much acid, it can offset all sorts of bacteria in your gut, and we know that your gut bacteria is important for your overall well-being. So I definitely think that's something you need to address. If you have active BV and urea plasma, we wouldn't. We would try and treat that first. I mean, putting an embryo into a known infected environment is not a good idea. And there are many studies that have shown that. So if you have active BV, the chance that you have BV-related bacteria in the lining of your uterus is substantial. And if they're there, we know that you probably have endometritis. And if you have endometritis, it's abundantly clear that that will have a negative impact on your success. Excuse me. You got a smirk.
Yeah, I got a smirk on it.
I can't read stuff because the screen's away from me. Now I want the double screen setup. I want to see what you're seeing. Is this the moderation stuff?
No. Soraya has claimed that she is your wife from Holland.
Whoa, only one wife. Only one wife. Love her dearly.
And then other girls are saying that you're going to get them in trouble.
Only one wife. No wife in Holland. Never found a wife in Holland. Never met a wife in Holland. Yeah, love my wife. Staying with my wife. We're good. Yeah.
Hence the smirk. Is taking a prenatal multivitamin... Oh, I did that one.
Spoiling my wife rotten.
There you go.
Love her to bits.
Here, this is the question.
Great woman.
That's what, yeah. You need to cover it.
Am I overselling it?
You need to do it. You need to do it. It's important. This is the time. She comes on usually at 8:55, so you're good.
Here's how much I love my wife. Okay, I love my wife so much that that we decided to get each other a gift that I never in my entire life thought she would go for. Something related to our cottage. And I adore her even more because she said yes to that. So, and she's not a huge fan of the cottage, but it was awesome of her. And so, honey, I love you forever, and there's no one else for me
Oh,
here or anywhere else for that matter.
including
Yeah.
Holland.
Except for Kate Beckinsale, but she knows about that. Yeah, we made an exception for Kate, but she's a smoker, and I don't go for that anyways. So
There you
it's
go.
all right. Yeah, yeah.
Does one grow tolerance to melatonin? You're making the question very difficult to read.
Oh, does one go? Oh, I have no idea. Great
I sleep
question.
well without it and wouldn't want to end up being dependent on it. How long is too long to be taking melatonin?
So I don't know of any evidence that says that there's melatonin dependence, but if I had a computer, which Tara currently stole from me, I would find out for you. I'm not aware of anything like that. I don't think there's a how long is too long. It's a supplement, so it's not a major issue.
I'm going to read this question. It's a little bit out of order because it's got a great question.
Okay.
Can you experience lightning crotch early on?
In pregnancy? If you're experiencing lightning crotch early in pregnancy, that's worrisome. So lightning crotch is you know what, that would be a great short. What is lightning crotch? We got to do that one.
I am super curious.
Right. So, because of the position of your uterus, which is like an old-fashioned hot air balloon, lightning crotch is when it feels like there are bolts of energy going up through your vagina up into your uterus. It is typically a sign that your cervix is starting to dilate and open. So if you're getting that early in pregnancy, that would be very worrisome for us. So you shouldn't be getting lightning crotch early in pregnancy. But later in pregnancy, it's quite normal because the cervix should be opening.
I always learn something new on this show. When I thought things don't get any newer, I learned about lightning crotch.
Lightning crotch, yeah.
It's good.
Yeah.
I cut a lot of people. I apologize, but
Okay.
it's new terminology.
Yeah.
I had to understand. Hello, Dr. V. Fiance is doing FET.
Okay.
Doc will go with the medicated protocol, 25 IUs of Gonal-F, overdose trigger, 5 days of progesterone before FET. Have you ever done a similar FET protocol and had success?
Yeah, so we do that for patients that have thin lining that doesn't respond to anything else. So we reviewed a study on the show 4 months ago, I think, probably 5 months ago, where we looked at a study from China where they took patients with very thin lining and they stimulated them with Gonal-F, basically, a recombinant gonadotropin. And they actually gave them 75 units a day and then watched to see if their lining thickened, and it did. And I actually did that for a patient from out west who shipped her embryos to us because her clinic wouldn't listen and they couldn't get her to thicken her lining. We tried it on the first try. She got pregnant and it worked out great. So, yeah, you don't have to worry. It's a reasonable protocol. Now, is it an optimal protocol? No. Would I do that for everybody? Definitely no. But is it a reasonable protocol for people with thin lining? Yes, it's a reasonable protocol for that group. Yeah.
Happy anniversary.
Thank you.
What are possible causes of a chemical pregnancies post-FET with euploid embryo?
Ooh. Your immune system, infection. The embryo may have been euploid, but not necessarily genetically normal. So remember, those are two different things. Euploid just means it has the right number and shape to the chromosomes. But you could have single gene defects, even multiple single gene defects, and the baby could still be genetically abnormal, just not chromosomally abnormal. So that can be an issue as well. It could be exposures, heat, chemicals, toxins, drugs, alcohol, cigarettes, nicotine, marijuana. Excess body mass index can cause miscarriages as well. Poorly controlled, health. So if you have autoimmune conditions, thyroid disease, diabetes, rampant inflammation, all of these things can contribute to it as well. So there can be quite a few different reasons. That's a great question always.
Is it normal to have shortness of breath the day after a FET?
No. And if you were on high dose estrogen, I recently had to take care of a patient who was not managed by me, and I will give no further details on, but ended up in my hands as a result of very, very traumatic outcome. So excess estrogen levels, or even high estrogen levels, typical with the medicated protocols, can lead to complications like blood clots, pulmonary emboli, that kind of thing. So if you are short of breath, make sure you are seeing your physician. Now, high doses of progesterone can make you short of breath as well, but make sure you go get checked out to make sure you don't have a blood clot, because that is dangerous.
At what point in the FET protocol is vaginal Viagra introduced for reduction of NK cell activity?
Yeah, there's a bunch of different studies on it. We typically did it either right from the start of our stim or when we started the progesterone. I think we typically do it more when we start the progesterone than from the start of stim. So that was what we were doing. I still use it from time to time. I'm not actually convinced it makes that much of a difference. PRP really seems to do well. The Neupogen seems to do well. Vitamin C, D, and E are really beneficial. Baby aspirin. Like, I think there's stronger stuff than the vaginal Viagra now.
I'm 17 weeks pregnant, have persistent vomiting, and have been on Diclexin, Gravel, Zolfran, and Maxaran. Still didn't 100% stop the vomiting. Besides that,
Wow.
I've not gained any weight since the pregnancy.
What to do?
Yeah, probably.
You need to go to the hospital and get checked out. Yeah, I mean, if you haven't gained weight in 17 weeks, that's concerning. And you shouldn't be vomiting that much. It's bad for your esophagus. So make sure you get checked out. Go see your doctor, or go to Emerge or Triage or wherever. You need a scope, or you need to be seen by a gastroenterologist. It's not normal to be on that many things and still have persistent vomiting. Something is not right, or needs to be done anyways to quell the impact of the vomiting, even if you're going to continue to vomit. Like, routine Gaviscon use and stuff like that to protect your esophagus. Acid reduction.
I have 35-day cycles. Is that okay, or is that too long?
So a typical cycle is supposed to be between 21 and 35 days. In general, what we find from a fertility standpoint is if your cycle is that long, the egg quality starts to get really compromised. So I'm not a fan of 35-day cycles, but it can happen. So that bigger question would be, are you actually ovulating? Because you're right on the margin of where we would call those oligo or anovulatory. So make sure you're checking to see if you are ovulating.
Is there any case you won't be put to sleep for an egg retrieval in the clinic?
If someone tells us specifically that they don't want to be put to sleep, I guess we would avoid it. But as a general rule, we try and get our patients very comfortable. Most of our patients fall asleep as a result of that process, but not everybody. Some patients will say, can I have more meds? Like, they'll be awake enough through it. I've had a couple of patients watch the eggs because we have this giant 50 inch, 55 inch, I forget, 50 or 55 inch television where patients can see their embryos and see their eggs and stuff like that. So, some of our patients watch it as they're going, but most of our patients are asleep because it's a real priority for me to ensure your comfort. So we want you comfortable, and the less you remember and sense from the experience, the better off it'll be.
Can urea plasma cause infertility?
Well, that's a great question, and depends on who you ask. So in human studies, no one has ever proven that urea plasma cultured from your cervix or vagina has caused infertility or recurrent miscarriage. But in animal studies, it's very clear, both in the uterus and at the cervix or vaginal portion. So animal studies show a decrease in fertility and an increase in recurrent pregnancy, loss, or miscarriage. So we kind of extrapolate that information to humans. We know that for patients that we find it on fertility in their uterus, we need to treat it, or else we have a much harder time getting them pregnant. So I believe that it can impact things, certainly from the miscarriage standpoint. I'm not quite as convinced that it helps with getting pregnant, but it definitely helps to reduce miscarriage by eradicating any urea plasma. Just don't let it fresh.
Hi, Dr. V. Adding to morning sickness, would you recommend acupuncture for morning sickness?
Oh, great question. I don't know any studies about that, but we could check that out. I gotta start making notes of all this stuff. Acupuncture for morning sickness. You know what? I'm gonna write that one down. That would be a great short. Can acupuncture help you with your morning sickness? Acupuncture for morning sickness. All right, good, cool. Thank you for the great question. I have no idea, but I'll find out.
How soon after a
Laparoscopy.
laparotomy
Oh, okay.
can you do a FET?
After a laparotomy, it would depend on what the laparotomy was for. Laparotomy is when you cut someone's belly open. I did a sideways thing. No one would ever get cut that way, up or down and side to side. So it would depend on what you were cut open for. The major issue with getting pregnant after a laparotomy is you don't want to strain the stitching in your fascial layer, which is the tough layer that holds everything in, because if that pops, you now have a massive hernia, and that's not good. So, I mean, I would personally say like minimum months, 3 to 6 months before you would go ahead from a laparotomy. That would be minimum, bare minimum. Buddy, you're tired.
How soon after an IVF miscarriage do you recommend waiting before doing the next transfer?
You don't have to wait. As long as you're healed mentally, emotionally, and physically, fire away. There's no benefit to waiting. That's actually been studied and shown to be completely inconsequential. You do not need to wait after a miscarriage to do another frozen embryo transfer.
Do you use the testosterone priming instead of estrogen priming?
Well, based on a study we reviewed on the show, God, I don't remember when that was, almost a year ago probably. Estrogen priming cuts your success rates in half. So we don't estrogen prime ever. Estrogen priming is not useful. And so we do testosterone priming, DHEA priming, human growth hormone priming, but we never use birth control and we don't use estrogen. And I'm not doing progesterone priming yet either. Maybe someday, but not yet.
Hi, Dr. Vic.
Dr. Vic, that's a new one.
My protocol included 450 gonal, low dose HCZ,
Whoa.
and cetrotide, and I had uneven follicle growth. What can be done to achieve even follicle growth?
Well, people say that estrogen priming, which we just talked about, evens it out, but you actually decrease your live birth rate. So I wouldn't recommend that. I would probably start with a lower dose of gonal F. That's a huge dose, and it'll make the cells with the egg cells with a lot of FSH receptors on them kind of sprint ahead. So I'm not sure that that's a great approach to things. Plus, that's a really high dose. The other problem with HCG is that the HCG actually tells the smaller follicles to die. So it depends on when you start it. So not everybody should be doing a low dose HCG protocol, or at least depending on where you're doing it, it'll make a difference on where in the cycle you started and how much you're using and so on.
Are your consults done virtually?
We do in person, we do virtual, I do both. I spent probably half of this afternoon doing virtual consults with people. We get them from all over the States, from from Australia, from the UK. We have tons of patients. I do a lot of European couples as well. I think my furthest was Japan. So yeah, we get people from all over the place. Just contact info@drvictory.com. Ask for a consult. They'll set you up. And we're cheap. We're actually cheaper than I thought we were. I think they're undercharging, but I don't really care about the money, so I'm going to leave it the way it is. You know how much it is to get a consult with a good fertility specialist in the US?
I have no idea.
Take a guess.
$500.
Okay, so the person I think is probably the smartest fertility physician in the US. Last time I spoke to her, she said she's charging $500 US for an initial consultation.
I was actually just joking with my number.
So we are 1/3 of that cost. Literally a third. Yeah,
And you got this.
that's crazy. It's a huge difference.
500 USD.
500 US. And that was like 5 years ago when I asked her. She's probably
Oh, way more.
way more.
Way more.
we're like a third to a quarter of it. Like it's the humane thing to do, right?
And you're way cooler.
Actually, she's very cool. I like her a lot, and I have a lot of respect for her. But
Yeah.
she's a very, very smart lady. Yeah, I would never bash her. She's awesome.
There you
She's
go.
expensive, but she's awesome.
After having a miscarriage,
Yeah.
is there anything I need to be mindful for the next pregnancy?
Ooh, well, I guess I'd want to know why you miscarried. Body mass index, smoking, drinking, drug use, exposures, chemicals, all that kind of thing. Is the shape of your uterus normal? Do you have an infection? Is there an immune problem? So yeah, I mean, I would want to know why you miscarried. If there was nothing wrong whatsoever and there's no suggestion or hint of anything wrong, no, just make sure your vitamins are good, make sure you're eating healthy, make sure you're exercising, do all the things you can do to minimize your chances of a miscarriage. Stay away from all the bad stuff.
Good evening, doctor.
Good evening.
Read a study that intercourse the night before FET improved odds. What do you think?
Tarek and I I'm laughing because Tarek and I literally just made a video on that before the show. So intercourse the night before an FET does improve the odds because the semen contains factors that prime the endometrium to accept an embryo. And that's been shown before. There are studies showing it's a very good effective primer. So yes, have sex the night before, unprotected sex with vaginal intercourse, with vaginal ejaculation, for sure. It's a very beneficial thing to do. And it's good for stress relief too.
Do you offer lit therapy?
We do offer lit therapy.
Good evening, doctor.
Good evening.
Do you recommend resveratrol supplements for FET prep? I have endo and adeno.
Oh, yeah.
What other supplements are must-haves for the endo and adeno FET prep?
We should do a short on the FET
FET prep for endo.
Yeah, endo and adeno and then PCO. Yeah. Resveratrol, definitely. There's lots of benefits to resveratrol, including now molecular science level evidence that it's good for preventing apoptosis, which is programmed cell death, and granulosa cells, which are the cells that surround the egg. So definitely use resveratrol. Very good for endo cases. You should also be taking curcumin, coenzyme Q10, resveratrol, ALA, alpha lipoic acid, and NAC, NAC, N-acetylcysteine. All 5 of those are what we use for ours. Some people use berberine as well. I don't know if there's a point at which we're kind of overdoing it. The other thing we do for our endo-adeno patients is an immune protocol, intralipid steroids, that kind of thing.
Why would some eggs not be mature at retrieval? I was on Lupron and 300 of Gonal and Menopur, and only 3 of the 7 eggs were mature. Only 1 fertilized.
Oh. Well, it could be the trigger. It could be the duration of your stimulation. It could be the size that they triggered at. And then people get what we call split cohorts, where some of the eggs are smaller, some are larger. So it all depends on ultrasound measurements, development, how you trigger, how long they waited till they retrieve. There's a bunch of factors that go into it, but those would be the reasons why. Great question. No one's ever asked us that before. Yeah.
Can moderate adenomyosis be cured?
Cured? Okay, so there's 2 types of adenomyosis. There's diffuse adenomyosis, where it's little spots all through your uterus, and then there's focal adenomyosis, where you've got like a clump of it that looks like a fibroid on ultrasound, kind of. So the clump can be removed. I still wouldn't say it'd be cured because it's impossible to get the margins right, but you can remove a clump of adeno. Diffuse adenomyosis, that cannot be cured because it's spread throughout the entire uterus. So you can't cure that. It's impossible. You can suppress it, but you can't cure it.
I'm getting a lap for suspected endo.
Sure.
3 field transfers, no known issues. My doctor wants to use ablation, and I don't think that is the proper approach. What are your thoughts on ablation?
There is no difference clinically between ablation and excision unless you have deep infiltrating endometriosis, DIE. Deep infiltrating endometriosis requires excision, but superficial endo, they've studied this before, there is no difference between doing a ablation or an excision surgery. And in most people's hands, considering that most gynecologists and even fertility specialists are not expert surgeons, it's a rare bunch of us that are left that are expert surgeons and also do the fertility stuff. In most gynecologists' hands, you don't want them trying excision surgery because underneath that superficial layer are nerves, vessels, your bladder, God forbid your bowel, like all sorts of things. One move, too far, 1 millimeter too deep, you're in trouble. So in the majority of cases, an ablation is perfectly fine and probably way safer than doing excision surgery. But if it's deep, yes, I excise it. If it's superficial, I don't always excise it. Sometimes I do, sometimes I don't, but normally I'll ablate if it's superficial. It's not worth trying to excise. It doesn't have any benefit whatsoever. And it may increase scarring as well.
How many babies do you think you have delivered in your career so far?
Over 15,000. I know it's a crazy number, but I delivered a lot of babies. Yeah, a huge number of babies. Somebody asked me that the other day. Somewhere between 12 and 15,000. It's hard to gauge exactly, but a huge number. On average, we do, almost probably 500 to 1,000 a year during residency. And then after residency, obviously it slowed down, but I was so busy doing obstetrics during fellowship and I took tons of call. And so I was still doing 300 or 400 a year. Right now it's slowed down quite a bit, but I'm still probably doing 200, 250 a year. So it's still pretty busy. So yeah, it's all added up.
Are you in the US?
I can be in the US. I'm licensed in the US. I am board certified for reproductive endocrinology and general obstetrics and gynecology in the US. When we were working on opening up a clinic there, but it's a work in progress, and economically it's not the best time right now to open up new US IVF clinics. So plus there's some tough competition where we want to open, so I'm not sure how that would work out, but we're looking at options. I may actually work with a clinic that's in existence there to help develop them and take a piece of the pie, so to speak. So we'll see.
Options on Gonal-F and Menopur.
I don't know if that's a question.
Option on Gonal-F and Menopur.
Oh, like between the two? Oh,
Yeah.
we always mix. You should have both. Gonal-F's really good at making lots of eggs.
Opinion.
Oh, opinion? Yeah. Gonal-F and Menopur is a very potent combination. We use them together. Gonal-F's good at making lots of eggs. Menopur is good at egg quality. So we use the two together.
It's my favorite uncle.
Jess, again. Hi, Jess. Jess, go to bed for God's sakes. Yeah.
Oh my God, look who it is. My favorite uncle.
Jess, this is not a PG rated show, honey. I don't think it's right for you. So, Sam, find your daughter.
Has anyone ever told you look like Elon Musk?
There are absolutely nothing in common between me and Elon Musk other than that he's a very driven guy, and I would definitely describe myself as a very driven guy. And we both obviously like cars. That's about as close as I'll get to being like Elon Musk. I hope someday that I can be as wealthy as Elon Musk and then turn around and make fertility care free for millions of people. That would be awesome. So that's what I would do if I was a billionaire. That would be very, very cool.
How long after a miscarriage can we start to try again?
Immediately. Yeah, somebody else asked that earlier too. Yeah, immediately you can try. There's no reason to wait after a miscarriage. There's no benefit. There's no risk to going right away. Fire away whenever you're mentally, emotionally, and physically ready.
What is your preferred FET protocol for endometriosis after lap and mild adeno, and why?
We've answered that a bunch of times.
Okay.
Super quick. Lupron and letrozole for 3 months for suppression, multiple supplements, letrozole protocol, high dose progesterone. It's pretty straightforward.
I have a gigantic question.
Oh, all right.
Gigantic.
Okay.
I don't know if you need to write it down or not,
All right. I'll make notes. Fire away.
but it's gigantic.
All right. It's a throat clearer, eh?
Oh yeah. Oh yeah.
Well, we got 5 minutes left, so
This
maybe
could
we
be
the end.
reading it could be enough. Hey, Dr. V,
Hey.
this is going to be a long one.
Okay.
As if my disclaimer wasn't enough. I've had 2 early losses this year.
Okay.
One in March and once in June 9th.
Oh, I'm so
The
sorry.
miscarriage started.
Oh, I'm sorry.
I'm 34.
Okay.
I'm overweight,
Okay.
but other than that, healthy.
Okay.
I have one healthy term pregnancy in September of 2021.
Okay.
All my vitamin levels and blood work are great.
Okay.
I've been in and out of the ER the past 2 weeks. I've had
In and out of ER?
ER.
Okay.
Yeah. I've had an abdomen x-ray, internal vaginal ultrasound, all clear, no remaining products of baby in me. And also just had a abdominal CT scan. I went for all this
What the
because of the pain I've had for months in my pelvic area.
Oh, pelvic pain. Okay. Yeah.
Also, felt like my urethra was inflamed, but no burning when I pee, etc.
Okay.
Results: the uterus has a small amount of endometrial fluid, but is otherwise unremarkable.
Okay.
There is a right ovarian cyst measuring 2.3 centimeters as noted on the ultrasound.
Okay.
No adenomass.
Okay.
No inflammatory process.
Okay.
Lung bases are clear.
Okay.
Anterior abdominal wall is unremarkable.
Okay.
No bone lesion.
Okay.
The uterus has an articulate morphology.
Arcuate.
Arcuate morphology.
Okay.
A variant of normal.
Right.
The endometrial complex
This
thickness.
is a serious question.
The endometrial complex thickness measures up to 0.5 centimeters.
Okay.
With no follicle endometrial abnormality, with no evidence of retained products of conception or intrauterine gestational sac.
Okay.
I continue. No abnormal vascularity.
Okay.
No uterine fibroids.
Okay.
Normal ovaries.
Right.
With a dominant 2.3 centimeter follicle in the right ovary.
Okay.
No adnexal lesions.
Adnexal. Yeah.
No abnormal pelvic free fluid. With all that said,
Okay.
they figured I had a uterus infection because of very high white blood cells in the urine.
Okay.
What can you suggest?
Because
going
of
forward?
really high white blood cells in the urine?
Yeah, that's right.
What?
What can you suggest going forward for me?
I would need to know what's wrong, first of all. So I'd be exploring what was wrong. Urine culture. You could do a culture of the uterus. You could check for endometritis, potentially laparoscopy to look for endo, cystoscopy to look for interstitial cystitis. I mean, there's all sorts of things. The weight could be an issue. I mean, if you're asking what to do to improve your chances, it depends on how overweight you are. As I mentioned before, weight can have a significant impact on your outcome. So if your body mass index is elevated, bringing it down can significantly alter not just your chances of success, but actually your reduction in risk of miscarriage. It wouldn't have anything to do with pain, mind you, but I would need to see you personally to be able to answer all of that. So, you would need testing, you would need evaluation, you need someone that's thinking outside the box to figure out what's going on. Feel free to reach out and set up a consult. I'd be happy to figure it out for you. That's a very lengthy, complicated question. Okay, we have 1 minute left, and Tarek has to go tonight because he has somewhere else to be. So we are not going to continue past 9. You got one question?
One.
That isn't 5 miles long.
One. Yeah. Let me see. Sometimes the comments are very good in the show. Like there's some,
Banter.
Yeah, banter's good. Even our viewers are now bantering.
That's good.
It's like we rub.
I like a little viewer banter. That's funny. They do that on TikTok like crazy. It's always hilarious.
That's always hilarious. Okay. I picked it from YouTube.
Okay, YouTube, fire away.
Okay. My doctor is planning to do a mini IVF.
Sure,
200 gonal, 75 men, dexamethasone,
that's not many.
100 clomid, and 25 HGH. This is the same protocol except we are adding HGH. I'm scared of another cancellation. What do you think?
Well, I need to know more details about you. That's definitely not mini IVF. Mini IVF by definition is 75 to 150 units. So you're already way over that. So that's not mini IVF, that's a normal stim. If you're looking for a DOR stim protocol, give us a consult. I'll go through your history with you and figure out what's right for you. People are different. There's not one size fits all. So for some people, we recommend PRP. For other women, we recommend microdose Lupron Flare if you can still get your hands on it. Some women need high doses of gonadotropins or higher doses of gonadotropins. Some don't need high doses because, you get people that only make one. I had a patient the other day. She said that her doctor wanted her to make more eggs. So they put her on like 600 units. She made 2 eggs. She then made 2 eggs in a cycle where she only did 150 units. And then the doctor said, no, I want to go back to the 600 to make more eggs. You're making the same number of eggs with lower doses. Why would you take 600? It only is going to be detrimental either physically, emotionally, financially, or on the egg. We know the high doses damage the egg. So you got to be really careful with that stuff and make sure you're getting the right dose and the right protocol for you. Don't just jump into it because this is what they do for everybody. Remember, and I'll end the show with this. Everybody say it together with me now. We are not baking cookies. We are making babies. No cookie cutter medicine for infertility. And with that, I will sign off. Huge shout out to everybody out there. I hope your journey for this week is successful. Next week, we will be talking about saving stem cells with our friends from Inception. So we're going to talk to an expert on saving stem cells and how it's done and what it's good for and where's the research going. And for those of you that finally get pregnant and want to do the best for your baby, this might be for you. So we'll be doing that, and I will be remote, so you'll probably see me very casual in my cottage. And T will be remote possibly too, although depending on what happens with my kids, he may come up to the cottage. So have a great week, guys. Stay safe, be well, and remember, advocate for yourselves or find a doctor that advocates for you. Have a great night, and we'll see you next week on Fertility.